All right, I've got Dr. Eric Osansky. I should have asked how to say that right. Osansky. How do you say your last name?
Osansky.
Oh, see, I was practicing before you came on and we're just chatting and I forgot to ask.
That's okay.
How do you say this right? So, Dr. Eric, we are going to talk about how we can improve the aging process, but specifically on thyroid and Graves' disease. And I love talking about this because it's very confusing out there, lots of different information, and love to hear your story. Starting with, tell us a little bit about yourself. What is your purpose, your mission, your why are you focusing on this area?
Yeah, well, I focus on this area because of my personal Graves' disease journeys. I was diagnosed with Graves in 2008 and was a surprise, a big surprise, as it is to many others who are diagnosed, most other people, and just realized that there wasn't a lot of support. I mean, just even these days, there's a lot more support for hypothyroidism, Hashimoto's, but not a lot of practitioners focusing on Graves. And I mean, I work with also people with Hashimoto's, but definitely because of my background, I see more people with hyperthyroidism, Graves. So yeah, my purpose is really just to try to, just like any functional medicine practitioner, trying to address the underlying cause of the problem. Too many of these people are just told to take thyroid medication or receive radioactive iodine or thyroid surgery, and nothing is ever done for the problem. Same with Hashimoto's. Usually it's just a prescription for synthetic thyroid hormone, and nothing's done for the immune system component.
So just give us a little definition of Hashimoto's versus Graves versus, low thyroid, high thyroid. What's what?
Yeah, so yeah, I guess it's probably best to start with hyper and hypo and then kind of lead into Graves and Hashimoto. So hypothyroidism, again, it's much more common, and that's when your thyroid hormone levels are low, and there are two main thyroid hormones. You have T4, T3. There's also T1, T2, but they can't be measured on a blood test. So just on a blood test, T4, T3. And then there's thyroid stimulating hormone, which is actually a pituitary hormone, and that signals, communicates with the thyroid gland to produce more thyroid hormone in the case of hypothyroidism. So when thyroid hormone levels get too low, you have an increase in TSH, and that's how it would present on a blood test. So a higher TSH, lower thyroid hormones. Sometimes, or actually many times, the hormones are within the reference range, but not within the optimal range. So they might be within the lab range. And then with hyperthyroidism, it's the opposite. So hyperthyroidism, you have an excess amount of thyroid hormone, so too much free T4 and free T3, and as a result, the pituitary gland is trying to tell the thyroid, let's not produce any thyroid hormone. So you have lower amounts of TSH, of thyroid stimulating hormone. And in the case of Graves, usually it's undetectable, like less than 0.01 on a blood test. And most of these cases of hypothyroidism and hyperthyroidism are autoimmune. And so most hypothyroid cases are Hashimoto's, most hyperthyroid cases are Graves' disease. And the way you figure that out is by looking at the antibodies. And there's different types of antibodies for, well, the most common antibody are thyroid peroxidase or TPO antibodies, which are actually common in, they're more closely associated with Hashimoto's, but they're also very common in people with Graves' disease as well. There are thyroglobulin antibodies, which those are definitely more commonly associated with Hashimoto's. And then the antibodies associated with Graves' disease are thyroid stimulating immunoglobulins, which is a type of TSH receptor antibody. And these attack or bind to the TSH receptor of the thyroid, which causes that excess production of thyroid hormone.
So with autoimmune, could you just give the listener an explanation of what that is?
Yeah, so autoimmunity is when the body pretty much attacks itself. So there's different types of autoimmune conditions. So in the case of the thyroid, the immune system again is attacking, in the case of Graves, the TSH receptors. In the case of Hashimoto's, thyroglobulin, the proteins of the thyroid gland essentially. And then if you have like with multiple, okay.
All right. Sorry, Eric, I lost you a little blip there. So we were just talking about autoimmune and the body's attacking itself. Go on with your explanation of that for the listener. Sorry.
Yeah, no worries. So I was saying where with thyroid autoimmunity, the body attacks different parts of the thyroid gland. So different with the Graves, the TSH receptors, and then the other areas of the thyroid with Hashimoto's, and then we have multiple sclerosis, which attacks areas of the brain, and again, so you have different autoantibodies, which really suggest or that different that the immune system attacks different parts of the body. And there are so many different autoimmune conditions. I think now there's like over 100 different autoimmune conditions out there, and I'm
Mhm.
sure many others that have not been diagnosed. And unfortunately, most of these practitioners, not just endocrinologists, but these other practitioners don't do anything to address the cause of the problem. They're either suppressing the immune system or, in the case of Hashimoto's and Graves, just really ignoring the immune system component altogether.
Hmm. So with your focus is the Grays versus Hashimoto's. So what are common symptoms of the both of those?
Yeah, so I mean the symptoms many it's I mean, you could get overlap, but like with when you have low thyroid, of course, you're going to get the metabolism slowing. So you're going to have fatigue, you're going to have weight gain, you're going to have brain fog, you're going to have cold intolerance, you're going to have constipation with hyperthyroidism because everything is it's everything is increased as far as the metabolism. So you have tachycardia, so increased resting heart rate, heart palpitations, tremors, anxiety. Instead of cold intolerance, you'll have heat intolerance. You'll have loose stools. With both of these, hair loss is very common. I mentioned weight gain with Hashimoto's. I lost 42 pounds when I dealt with Graves, and I wasn't trying to lose. I was down to 140, which I wasn't trying to get that low. I was trying to lose a little bit weight, but that was
Mhm.
pretty extreme in my situation. So yeah, I mean there could be overlap. There are some people with Graves that do gain weight and don't lose weight, and again, the hair loss is common, but
Mhm.
typically you'll have those different types of symptoms with both with hyper and hypo.
Hmm. Yes. And then so people are having symptoms and they don't really understand, okay, what's going on with me? Something's wrong. What would you suggest how they can go the next step to get help and test and not guess?
Yeah, great question. So, I mean, yeah, you definitely want to start out with blood testing. I mean, eventually the functional medicine approach is to like try to find the cause of the problem, but you want to get that diagnosis. So you want to test the thyroid hormones that I mentioned earlier that I like doing the free hormones, free T3, free T4, thyroid stimulating hormone, the antibodies. There is something called reverse T3, which so it's T3 is the active form of thyroid hormone. Reverse T3 is the inactive form of thyroid hormone. And with you don't want to have too much reverse T3 because that blocks thyroid hormone from getting into the cell. And there's a time
Mhm.
and place for that. Like hyperthyroidism, you would expect to have elevated reverse T3, but we wouldn't want to see that with hypothyroidism, Hashimoto's. And so, yeah, the starting point is to get that blood test. Like at first, in my story, I had an elevated resting heart rate, and that's how I knew something was wrong. So the next step for me was I went to a primary care doctor, just got some blood tests done, what got the diagnosis of hyperthyroidism, eventually went to an endocrinologist and got the official diagnosis of Graves. And that's usually, at least in the case of hyper, usually you'll start out with the primary, get referred to an endocrinologist. With Hashimoto's, it depends. Sometimes you'll just go to the primary care doctor. Many times they won't even test the antibodies though. Sometimes they'll just test TSH, sometimes they'll just test TSH and T4, and the reason for that is because the approach isn't going to differ. It's either way, they're not going to do anything for the immune system component. But ideally, you do want to do a full thyroid panel.
It's amazing how many doctors just do the thyroid stimulating hormone, then prescribe thyroid medication for that and not really understand what's going on and see the whole picture.
Yeah, I agree. I mean, it's again, it's a pituitary hormone, so it can potentially be a pituitary problem and not a thyroid problem. But it's yeah, very common where they'll just look at the TSH and some doctors, that's all they'll do. So you're absolutely right.
What about the your experience with optimal ranges, functional medicine ranges in labs versus normal that you'll get from your doctor?
Yeah, I mean, it's as I mentioned earlier, you like what in the case of hypothyroidism, a lot of cases are subclinical where they're within the lab range, but not within the optimal range. And as a result, a lot of people don't even get diagnosed to begin with because TSH, ideally, I like to see TSH between 1 and 1.5. And no, the right most labs have an upper end of like a cutoff of 4.5, some of them 5. So someone might have a TSH of 4, and most labs will consider that to be normal, but it's not optimal, not within that
Hmm.
1 to 1.5 range. And the same thing with the thyroid hormones. I mean,
Hmm.
we don't want anything to be on the higher ends or lower ends. So if someone is on the lower ends, but they're within the lab reference range, most regular medical doctors will just blow it off. And not just with thyroid, with anything, with any marker, you don't like to see things on the higher ends. Or like a vitamin D is most labs, at least in the United States, it's between 30 and 100. And so if someone is 31, again, from a functional medicine standpoint, we know that's low, but it's within the lab range. So most doctors aren't going to do anything if they see that vitamin D level. And the same concept with thyroid testing.
And with the antibodies, you mentioned a couple. So if we could just review the with Hashimoto's antibodies you want to look for, and what is the optimal range versus Graves' disease autoimmune or antibodies and how they relate.
Yeah, sure. So Graves gets a little bit tricky because there's different labs have different reference range. So like in the United States, if you go to LabCorp and you go to Quest Diagnostics, they'll have two completely different units of measurement. So like LabCorp, it'll be I forgot the units of measure, but it's like 0.55, like is like their cutoff, whereas with Quest, it's 140, like it's a percentage. So you can't really compare it. And they
Mhm.
just changed that a few years ago. Like when I dealt with Graves, it was just a percentage back in 2008. But for whatever reason, they changed it. But with both of those, you want to see them well below the reference range. So again, let's say if we're going by the percentage, like 140, I like to see it. I mean, obviously, we want to see it as low as possible. But I mean, some auto antibodies are actually common and normal as part of like the cleanup process. So if it's not zero, it's fine. I mean, I like to see it at least less than 80, less than 50 would be even better.
Mhm.
Um, and for the other unit of measurement, 0.55, I like to see it like zero point 0.3 or less. Again, lower than that's even better. But the key is stability too. So like if someone has, as long as they're staying well below the reference range once they get there, I'm not too concerned. And Hashimoto's, it's a little bit, it's also the ranges have changed over the years. Like thyroid peroxidase, some labs will say there's a range, like the range should be like between 0 and 34. Others will say it should be less than 9. I mean, I like seeing it in single digits. But again, if like the different labs do use different methodologies, so I mean, if the reference range is 34, and if someone has like a TPO of 18, that's still on the lower side. I mean, I see, as I'm sure you do as well, TPO antibodies in the hundreds, sometimes the thousands, and thyroglobulin antibodies. It also depends on the labs, but both LabCorp and Quest, they now recommend for it to be like zero. Like if it's, I think the range again is like less than
Mhm.
one. So, which
Mhm.
essentially they want it to be zero, which is not how it was in the past. So I'm not sure why they changed that. So, I mean, again, with all these autoantibodies, we want to see them obviously as low as possible. And yeah, I mean, if we could get them, like in the case of thyroglobulin, where it's less than two, I mean, less than one, that's great. But if someone, everything looks great and someone has thyroglobulin antibodies of two, which is above the reference range, and it's like holding steady and it doesn't seem like it's doing damage, because that's another thing. Just because you have the antibodies doesn't always mean you're having damage to the thyroid gland. Um, so those are some of the like functional ranges, but like I said, it does really depend on the person.
And you spoke a little bit that the TSH is measuring pituitary gland function and signaling to the thyroid. But if we could just touch a little bit on T4 is inactive and it needs to convert to T3 and how and where that happens.
Yeah, so you have so yes, most of the T4 is actually produced by the thyroid gland. And like you said, that is the inactive form of thyroid hormone is T4. And T4 needs to convert to T3, which is the active form that binds to the receptors. And about 60% of this conversion takes place in the liver. Another 20% takes place in the gastrointestinal tract. And then there are other factors that could affect conversion, such as stress, high cortisol, even like if someone has a selenium deficiency, that could affect conversion. But obviously, 80% is in combined the liver and the gut. So those areas are extremely important when it comes to optimal thyroid conversion. And it's common. I mean, again, there's a lot of people that have normal T4, low T3, and this is another issue that most doctors won't test T3. So again, many, as we just mentioned earlier, will just test TSH, but then there's another subset of doctors that will look at TSH and T4, but won't do anything for T3. And again, the reason is because it doesn't make a difference. They're going to give synthetic T4. They're not going to give T3, and they're going to pay attention just to the lab range. So if someone has a TSH of 3, a T4 that maybe is looking okay, maybe that T3 is on the lower side, but they're not testing for it, so they don't know. But even if they did, it probably wouldn't change their approach as long as the TSH and the T4 were within the lab range.
So are you finding that people given T4, they're not getting the desired results from fixing the root cause problem?
Yeah, I mean, definitely. I mean, again, there's a time and place also for to give T3 or to take desiccated thyroid that such as Armor or NP thyroid. But yeah, and the ideal situation would be even if you have to take those to try to fix the conversion problem, which I mean does take time. It's not
Mhm.
overnight fix, just like anything else takes time. But yeah, you definitely want to try to work on addressing the cause of the conversion problem.
So when you're looking at working with clients, patients, are you seeing other clues to conversion problems, if it's liver or gut related? What are you looking at to collect the missing pieces of their health puzzle to determine what's going on?
You mean specifically with conversion or?
With conversion of the thyroid. So if someone comes to you and has symptoms of high or low thyroid issues, Graves' disease, Hashimoto's, are you working on looking at other blood chemistry markers to see any signs of liver congestion problems or if there's gut dysfunction, maybe some other labs? How do you put the pieces of the puzzle together?
Yeah, so I mean, great question. I mean, yeah, we definitely do comprehensive blood testing, functional medicine testing. So we'll look at the li like a comprehensive metabolic panel that looks at the liver markers, not just AST and ALT, which are liver enzymes, but GGT, which is another one that many practitioners don't test for. We'll I mean, of course, we do the basics like CBC with differential, and I mean, even some of that like that might not seem like it relates at all to the gut, but like for example, I mean, everything's important. So if we, do a CBC with differential in, especially let's say someone who's in postmenopause or a male, and they have an elevated RDW, which is the width of the red blood cell, that might suggest an iron deficiency, which I always recommend an iron panel. And so if someone has an iron deficiency and they're not menstruating, then we want to ask why. Is it a gut problem? So again, I'm just bringing that up that all the tests are important. Now, it's not going to tell you what's going on with the gut, and that's where some functional medicine testing could be helpful. Doing a comprehensive a comprehensive stool test to see if someone has H. pylori that is affecting the absorption of iron because H. pylori affects stomach acid production, and stomach acid is important for breakdown of minerals, digestion of minerals, yeah. So if you have H. pylori, you might have low iron. You have parasites, that could obviously wreak havoc on the gut. I mean, I'm always one to test and not guess, and being that you're an FDN, I imagine you do the same, and and like to do testing. So yeah, like looking at things like heavy metals. I mean, there's so much testing, and that's why also you gotta at least I
Yeah.
try to prioritize and not say, okay, let's do everything,
Yeah.
but I do like to do adrenal testing because again, everybody has adrenal problems, but different people have different patterns. And seeing is believing too, like realizing that your adrenals aren't in good shape, which was the case when I dealt with Graves, and I was in denial. I thought my adrenals would be okay. I knew stress was an issue, but I thought I did a good job of handling stress. And then I saw cortisol was low, DHEA was low, secretory IgA was low, which speaking of the gut, secretory IgA lines the mucosal surfaces of the body, including the gastrointestinal tract. So if that's depressed, it's not a specific leaky gut marker, but a good indication that you have a leaky gut. And yeah, so I mean, again, if we're seeing certain, I mean, regardless of what we see on a thyroid panel, we're going to do some functional medicine testing, but sometimes the health history, of course, dictates what type of testing we'll do. In some cases, we'll do a SIBO breath test if someone's having a lot of gas, bloating, especially when eating certain foods like fermentable foods and
Mm.
other higher fiber foods. And so maybe the answer will be in a SIBO test and not in a comprehensive stool test. Sometimes maybe both. I mean, people could have multiple problems. So that's where the detective work comes into play, is just trying to figure, and sometimes it might just be a food problem. Maybe it's just gluten. You have to cut out gluten because that is affecting the gut, causing that increased permeability. So, yeah, so we look at food, we look at stress, we look at testing, things like the gut and the adrenals, and I mean, sometimes like we'll do like organic acids testing or mycotoxins testing for mold. It
Mm.
really depends, and all this could tie into going back to the conversion problem. One thing I didn't mention, inflammation just by itself could also affect conversion, and all these things that I
Mm-hmm.
mentioned, as you know, definitely can affect inflammation.
Mm-hmm. Yeah, it's amazing how much, we can spend thousands of dollars in lab tests, but I think, as you said, it's really important to get a good intake form, as I use nutritional therapy assessment. So you really want to look at the client, what they are presenting. So you can figure out, all right, yes, we could order these 5 labs, 10 labs, and really go into it. But most people have a budget and
Yeah.
want to get help and get specific guidelines, but it is figuring out what's best for them. So when you're looking at the autoimmune issue with Hashimoto's or Graves' disease, what are you finding as root causes? Is this never one thing?
Yeah, you're right. There's usually multiple things. I mean, food definitely could be a factor. So I mentioned gluten, and without question, have everybody avoid gluten and common allergens, especially when healing, like dairy. I can't say I have everybody avoid dairy forever, but at least while healing, to take a break from dairy, and so kind of follow an elimination type diet, and that can make a big difference. Just eating that whole foods, anti-inflammatory diet. Stress is huge. I mean, again, I mentioned my experience with Graves, and I see this with so many other people. And it's important to mention it's not just the emotional stressors. So just overtraining, just overdoing it. And a lot of people have a habit of, I mean, of course, there's those that couch potatoes too, but again, a bit just as big of a problem of those, not just those that are sedentary, but those who are active but are too active and not listening to their body. And that also described me prior to Graves. I was not listening to my body. I was exercising too hard, and that also was a stressor. So stress is something that's a big factor with a lot of people. Um, our toxic environments. I mean, it's just getting worse and worse. And I mean, some of these environmental toxins and toxicants will directly affect the immune system, causing dysregulation of the immune system. Some of them will affect permeability of the gut, and leaky gut is a factor in all autoimmune conditions. And some of them will directly affect the thyroid. We have endocrine disrupting chemicals, all the plastics out there, including the microplastics now that we hear about, are endocrine disrupting chemicals and could directly affect the thyroid. And then infections. I mean, infections. I mentioned H. pylori is something I see in a lot of people, and I know correlation doesn't always mean causation. That's definitely an area of controversy. Should we treat H. pylori in everybody when it's positive? I mean, in my patients, if I have a Graves or Hashimoto's patient and they have H. pylori that's clearly positive, I'm going to recommend an herbal protocol. I won't recommend the antibiotics. Ultimately, that's their decision, but I will recommend a protocol. Um, so, I mean, H. pylori is common. I mean, mold is actually common too. Uh, I mean, again, there's a lot, like you said, there's a lot of different factors. I mean, parasites are tricky because parasites, I think, are definitely a factor, but I think also there's a lot of false negatives on stool tests. So a lot of the stool tests I do, even when I'm suspecting that maybe there's parasites, and then it comes back negative. And so that's different stool tests also. Some are better than others, but even the good ones are not perfect. So that's also something to keep in mind. But yeah, so food, stress, you know, um, certain infections like H. pylori, I mentioned the mold, environmental toxins such as mercury, and again, the plastics I mentioned, all of those are common factors.
So when you are taking a root cause approach versus to help people with autoimmune Hashimoto's and Graves' disease, is not just treating the lab results that come back if they're elevated or declines. You're looking at what we all love in functional medicine is investigating what's actually causing this to be higher or lower than optimal, and really helping someone to figure out the why versus just here, take this medication and let's see what happens.
Yeah, exactly. I mean, that's why people see me, that's why people see you because I mean, there's a time and place for the medication. When I work with I mean, when I dealt with Graves, I chose not to take the medication. I was able to manage the symptoms naturally, but some people need to take the medication. Some people with Hashimoto's need to take thyroid hormone replacement. The frustration, again, is that's all that the doctors do is give the medication, or again, in some cases of Graves, thyroid surgery or radioactive iodine. Um, but yeah, there's a reason why you develop Graves. There's a reason why you developed Hashimoto's. Uh, are genetics a factor? Yeah, there is a genetic component, but environment plays a bigger role so you can't reverse the genetics. You can, of course, modify the expression of genes through diet and lifestyle and find remove triggers, heal the gut. It's not easy to do. It is a lot easier just to take medication or take thyroid hormone replacement, but one of the big concerns is, and this is according to the research, not just me saying this, is that if you have one autoimmune condition, you're at greater risk of developing other autoimmune conditions in the future. So if someone has Hashimoto's and all they do is take thyroid hormone replacement, they might feel okay. Again, a lot of people don't feel okay, but some people feel okay taking the thyroid hormone. But the problem is by not doing anything for that autoimmune component, you are at risk of developing other autoimmune conditions in the future.
So it is looking at a holistic approach and working on systems, order operations, and how to help the client, but also that you cannot out supplement poor lifestyle habits as well as I would say can't out exercise poor nutrition habits. So it's really looking at this holistic approach. So what is your kind of order of operations, your methodology to help clients improve?
Yeah, great question. I mean, with hyperthyroid, I mean, even with Hashimoto's, but more so hyperthyroidism, we do want the person to be safe before addressing the cause of the problem. So again, we want to make sure that the thyroid hormone levels don't stay high while we're addressing the cause. So whether it's taking an herb like bugleweed, which is what I took when I dealt with Graves,
Mm,
or if someone needs the anti-thyroid medication, same thing if someone has hypothyroidism and it's really low, we want to address the cause of the problem, but it could take time. And if someone absolutely needs thyroid hormone replacement, so again, there is a time and place for symptom management. But the foundations, I mean, the
mm,
foundations are extremely important. So again, cleaning up one's diet, blocking out time on a daily basis for stress management, doing
mhm,
what you do isn't as important as just doing something because you want to do what you're willing to do. If you're willing to do deep breathing, great. If you hate deep breathing and you want to do yoga, fine. Whatever you're willing to do, getting proper sleep. Again, that falls under foundations. Too many people not getting sufficient sleep. Sometimes it's intentional. Sometimes people just can't fall and or stay asleep, and we need to work on that. Again, regular movement is important, but not overdoing it. And then doing like basic things to reduce one's toxic burden. You could do most of those things you're going to be doing in your own home because you don't have a whole lot
mm,
of control walking outside. So incorporating the foundations and then the testing. So the testing that we spoke about and just using the health history to kind of determine what test does someone need? Do we need
mm,
to is it is it a Dutch test? Is it a comprehensive stool panel? Is it mold testing? Is it a SIBO test, organic acids test? Again, there's a lot of different tests to choose from. And like you said, people have a limited budget. So I'll recommend what's necessary, but I am more on the conservative side. So, I mean, we could always, again, pretty much I leave it up to the person. You could be conservative, comprehensive. I'm going to recommend what I think's necessary. And, if I'm not sure if there's one or two tests that I think could be helpful, but I'm not sure if they're absolutely necessary, I'll kind of list them as optional and just leave it up to the person. But doing the testing and correcting other underlying imbalances like nutrient deficiencies, which also relate to like some of the testing that we do as well. But really, I mean, those are I mean, there's obviously a lot within these, like what happens when we find the triggers and underlying imbalances, supporting, I mentioned incorporating foundations, but, if someone has molds, probably we're going to need to do more than the foundations. You're going to have to address the source of the mold, and you might have to,
mm,
like you said, you don't want to just take supplements and neglect diet and lifestyle, but in the case of mold toxicity, you might have to take some binders, you might have to
mhm,
take some NAC or glutathione. If you have H. pylori, again, you might have to take some herbs, or I mean, if you choose the antibiotics, but either way, so there are definitely times when you have to go beyond the foundations, and that's really why we're doing the functional medicine testing. If just addressing the foundations alone would heal everybody, then we would just say, just incorporate the foundations, just change your diet, block out time for stress management, and get regular movement, all that good stuff. But many times we do need to go beyond diet and lifestyle.
Have you seen patterns with clients with liver congestion and or gut inflammation relating to Hashis or Graves? Is there any trends,
Um,
patterns?
I mean, liver, well, I mean, I'll say with hyperthyroidism itself puts a lot of stress on the liver. I mean, so does the medication. The anti-thyroid medication puts stress, but even the thyroid itself. So on even on a comprehensive metabolic panel, it's pretty common to see elevated liver enzymes. I mean, we'll usually see elevated alkaline phosphatase, but that's more related to the bone turnover than the liver, because when you have that increased metabolism, it's going to affect bone density in a negative way. Um, but and then with the gut, I mean, I mean, there's some dysbiosis patterns, but I don't know if we could really say that it's related specifically. Like again, that H. pylori is very common. Now, again, I'm sure it's common. I don't work with other autoimmune conditions, so I don't. My guess that probably also shows up in people with rheumatoid arthritis and multiple sclerosis and lupus and all these other conditions. But even in the research, there's a relationship between H. pylori, Graves, and Hashimoto. So that's one of the things. I mean, I see a lot of streptococcus, but I don't know if that's really related to the Graves or more just correlation. You know, again, not necessarily causation. Same thing with Akkermansia. See a lot of low Akkermansia, but is that really related to Graves or Hashimoto's? Blastocystis hominis seems to be a little bit more common in Hashimoto's than in Graves. And other markers like calprotectin. I can't say most people with Graves and Hashimoto's have elevated calprotectin, which is an inflammatory marker. Secretory IgA, on the other hand, not everybody, but a lot of people have low secretory IgA. Again, is it exclusive to Graves or Hashimoto's? Probably not. But regardless, though, and low pancreatic elastase, which we also see a lot with H. pylori. So um, but yeah, so those I'd say would be some of the more common patterns with liver and gut, and then adrenals. Also, we could ask the same question. I mean, and again, a lot of people have low cortisol, low DHEA. Sometimes I'll see elevated cortisol, but I'd say a lower cortisol pattern with low DHEA is also more common with both Graves and Hashimoto's.
Hmm. So you've spoken to being helping people resolve these issues, Hashimoto's and Graves. What have you found to be a good solution for people to hopefully get rid of it, or do you just put it into what do you call it?
Remission?
Not remission. That's the word, remission.
Yeah, it's funny because of that genetic component, I don't like to use the word cure. Maybe part of it is superstition. Like I don't want to jinx myself because I
Yeah.
feel like I've been cured since 2009, but I just say I'm in remission. I've been in remission since 2009, and I talk about let's try to achieve permanent remission, which essentially is a cure. And so, um, I mean, again, all the things we spoke about is essential. I mean, not that people have to do, again, we spoke about the functional medicine testing, that'll vary. But as far as getting that person, whether again you want to say cured or just restore the health, I mean, essentially reversing the autoimmune component is what we're trying to accomplish. We're trying to,
Hmm.
get those antibodies as low as we can, ideally within the optimal ranges, like we mentioned earlier. And in order to accomplish that, we need to incorporate those foundations I mentioned earlier. We need to find and remove the multiple triggers that we discussed, and that's where the testing comes into play to try to find those triggers and then do things to heal the gut. Because again, according to that triad of autoimmunity, uh, you need a leaky gut, that increase in intestinal permeability to have autoimmunity. So based on that, it's almost impossible, if not impossible, to have a healthy immune system if you don't have a healthy gut, especially since most of the immune system cells are located in the gut. And so yeah, I mean, it sounds, maybe it doesn't sound simple, but for some people, it's like, incorporate foundations, find and remove triggers, heal the gut, correct underlying imbalances like nutrient deficiencies. Again, you do those things, and that's again, there's a lot that goes into each of these, but that's really what it comes down to when it comes to reversing the autoimmune component of both Graves and Hashimoto's.
You were just speaking of, I think, the gut thyroid immune axis. You talk about with healthy gut, healthy thyroid connection. Is that what you're speaking of to autoimmune disease recovery?
Yes. So again, there's what's called the triad of autoimmunity, and triad of autoimmunity, the genetic predisposition, exposure to one or more environmental triggers, and a leaky gut. And leaky gut. Now more and more doctors, I mean, medicine doctors have been acknowledging and aware of a leaky gut for a long time. But even now, some medical doctors are realizing, maybe because it's actually in the research, and yeah, so I mentioned most of the immune system cells are located, in the gut. We mentioned also that conversion, like 20% of that conversion process takes place in the gut. And but from the standpoint of autoimmunity, since most of the immune system cells are located in the gut, and that leaky gut is part of that triad of autoimmunity, you really do need to do things to heal the gut. And a lot of people do some great things, but I'm sure you're familiar with like the 5R protocol of gut healing: remove, replace, reinoculate, repair, rebalance. A lot of people skip over the remove component and just they take enzymes and probiotics and drink bone broth, and these are great. I think, I recommend these things, so it's not like I don't recommend them, but if you're not removing the factor that's causing a leaky gut, if you keep on eating gluten, for example, which has been shown to increase permeability pretty much in everybody, and if you have a gut infection, if you uh, are being exposed to a lot, everybody's exposed to environmental toxins, but if you're drinking water out of plastic bottles, that's not only disrupting the endocrine system, but also that's been shown to affect permeability as well. So if you're, again, the more you can do to optimize the health of your gut, not to mention trying to minimize, time and place for antibiotics, time and place for proton pump
Mm.
inhibitors, but there's also medications that disrupt the gut, including anti-thyroid medications such as methimazole and PTU. Again, time and place for all these types of medications. Um, but yeah, so gut health is very important when it comes to reversing autoimmunity.
With the gluten part of it, have you found it beneficial to add in removing the other molecular mimicry gluten items? Because there's a list of food that your body might see as gluten, and how there is thyroid is seen as gluten is seen as a thyroid, so the body attacks itself, is why people suggest with thyroid issues to remove gluten.
Yeah, are you asking about the molecular mimicry in gluten or like as
Yes.
far as that? Yeah, it's, if you're familiar with Dr. Tatis Karazian, so he wrote
I just
years ago.
listened to
Did
him
you? Okay.
yesterday, and someone asked me about him yesterday on a show I was recording, and today. So
Okay,
he
wow.
is, yeah.
So yeah. So again, he wrote one of the first books on autoimmunity, and he was talking about like Th1, Th2 balance. This goes back, I think it was like 2010. And so he's the first one I heard of that was talking about that, the molecular mimicry and like the proteins of gluten mimic the thyroid gland, resemble the thyroid gland. And now I haven't seen that in the research because I was looking because I try when like writing my books and other articles. I try to refer to the research. And again, he's amazing. He's very knowledgeable. So I usually, when he says something, I just listen and just take his word for it. But in this case, I wanted to actually see. And in this case, I wasn't able to find really firm research about gluten, having a similar amino acid sequence as the thyroid. So the honest answer is I don't know. I usually recommend to avoid gluten, not necessarily because of that, because that could be, but regardless of that, it's just because I know the first study I think was 2015 showing that it causes a leaky gut in everybody, so not just people with celiac disease. So for that purpose, I recommend avoiding it. Now, the next question is, can you ever reintroduce it when you avoid it? Like, do you have to just avoid it while healing? And again, in a perfect world, I would say avoid it permanently. But most people, when they go to a restaurant, they're probably not going to gluten-free, like a dedicated gluten-free restaurants. And so there will be some cross-contamination. And so it really depends on the person. If someone has celiac disease, they probably don't want to get that cross-contamination. If someone doesn't have celiac disease, then it might be okay occasionally. Again, if you ask Dr. Tatis Karazian, he'll say even like a small amount of gluten could cause inflammation for like 6 months. So his answer would probably be just even when you're healed, if you have Hashimoto's or Graves, just do everything you can to, even with the cross contamination, to stay away from it. But like I said, so either way, I do recommend definitely while healing, avoiding it. But even after restoring your health, at the very least, even if you're not dealing with celiac disease or non-celiac gluten sensitivity, you still really want to minimize gluten. There's no health benefits of eating gluten, and there are, yeah, there are other foods that like cross reactivity foods like corn is also one that has like gluten-like reaction. So, and that's a big problem because a lot of people when they go gluten-free, they'll get something that has corn. They'll get their gluten-free cookies, and maybe it's again, I mean, thankfully there are now like paleo and AIP version of these foods. Again, they're still processed, but still they don't have like the common allergens. But if you go and get, I mean, I'm not even familiar, but if you get like gluten-free Oreos, I could just imagine like what's in there. I don't know if there's
Yeah,
corn in there,
garbage.
but
Yeah,
but yeah.
not good. So it's funny because I just got back from 2 weeks in Italy and I'm always well, I'm not gluten free. I say I'm wheat free here and strict with it. And then since I've been tested on the Vibrant Wellness Wheat Zoomer, I haven't been to Europe. And so I said, okay, am I going to be wheat free or am I just going to just test it out? And I don't have any symptoms or gut issues, but so I did just say screw it for 2 weeks. And I did have the pizza because there's nothing else to eat. I don't know how people
Yeah.
survive there on not having carbs, but all they
Mhm.
eat is pastry stuff and coffee, and then there's pizzas. I don't really like pasta, so it wasn't a big deal if not pasta, but pizza. And so I'm always curious. People say the wheat versus in the U.S. or North America, well, maybe it's just U.S. is a lot more damage because of glyphosate versus wheat grown in Europe. And I'll hear different things as it's different. Dr. William Davis will say, no, it's all the same and it's still going to damage your gut wall lining and cause leaky gut. But so now just go back home and do a gut healing protocol.
Yeah,
It's
I'm glad you brought this up actually. First of all, I've never been to Italy, so I was having this conversation with someone the other day, and I said, my wife wants to go to Italy, and when we go, I'm probably not going to be gluten free just because, again, I probably will have the pizza there just to be upfront. I told this person, I
yeah,
understand when my patients go to Europe and they're like, I'm probably not going to be on the diet, and I'm not, I mean, I would say try not to go to Europe while healing is what I would say. So I'm not going to give someone permission and say, oh yeah, it's fine going to
yeah,
Europe. But Dr. Tom O'Brien, who I'm sure you're also
yeah,
familiar with, he's like the gluten expert. And he actually, coincidentally, he lives in Italy right
yeah.
now.
Oh, that's
Um,
right. He was in
and
Switzerland. Now he's in Italy. He's living the
yeah,
life.
yeah, but he hit. So first of all, he talks about like glyphosate is still like it's in Italy. I mean, I
Mm,
had someone. I was on someone else's podcast in Australia, and they were like glyphosate's in Australia. So it seems like it's everywhere. But I asked him actually this exact same question because he's like the gluten expert, and what he said is kind of like what William Davis mentioned. Like wheat is wheat, and the reason why some people do better in Europe when eating wheat and not in the United States is not because of the gluten or the glyphosate, but it's the FODMAPs, that the FODMAPs are
mm-hmm,
higher in the United States than they are in Europe. So if
mm-hmm.
people feel like gassy, bloating
Yeah.
in the United States, it's more of a FODMAP problem and not really the gluten. So,
Mhm. Yeah, I heard that. I've had Dr. William Davis on the show, I think 4 times now.
oh wow.
We've been talking about the super gut and making the yogurt and stuff. So one thing I heard about Dr. Ruscio's podcast, he was talking
Mhm.
about research of the thyroid and red light therapy. Have you ever read any recent research on using red light therapy for thyroid treatment?
Yeah, I mean, it actually goes back to, I wrote an article, I think it was 2015 on cold laser
Hmm.
therapy, or
Mm,
really helping to potentially regenerate thyroid tissue, helping even with antibodies. And then I've had a few experts on my podcast. I've had Dr. Kirk Gare on the podcast who uses cold laser, and then recently Dr. Brandon Crawford, who likes both, like red light
mm,
therapy and cold laser. So really pick their brain since I've done some research, but they've done a lot more than myself, and they just both agree that I think more, like Dr. Kirk Gare, he talks more about cold laser. Like he says that
mm,
cold laser is more effective than just red light therapy when it comes to helping thyroid. With Dr. Brandon Crawford, he seems to think that both of them could be equally effective, from what I recall. So, but the answer is, yeah. I mean, just with anything, you want to be careful, probably doing it on your own. I mean, I have a red light unit, so I'm definitely not against using the red light units, but yeah, there's like you're probably familiar with Ari Whitten. He has a book, Red Light Therapy, and he actually
Right. Yeah.
gives, it's somewhere around my office too, and he gives some great information in the book, like really gives like specifics as far as like
Mhm.
distance of the red light therapy unit and all that. So, I mean, if you're not going to work with, ideally want to work with someone, but if not, at least pick up his book.
Hmm. Yeah, it's why I was saying I live Solana Beach is straight ahead of me, and Ari Whitten lives there, according to his information. So I moved here. I was like, oh, he lives here, and I've never seen him since. But I've always
Ah,
loved his information in the mitochondria and
hmm.
restoring your health. So with the red light therapy, one other thing I was testing out is a company called Kineon, Kineon. They have a device, and it has three small ones. Actually, took it with me to Italy and used it on the plane, and you can wrap it around your neck and put them right against your thyroid. So I've been testing that out, but
Hmm.
it was
Interesting.
interesting research they were sharing with me. So to wrap up, what if you have people that are listening that are struggling with getting the right results with Hashimoto's, Graves' disease, even low thyroid? What do you feel you can help people? What message you want to get across to them?
I mean, the biggest thing is that there's hope. I mean, if you go to your conventional medical doctor or your conventional endocrinologist, that not only will they not mention anything about addressing the cause of the problem, but if you bring it up to them, they're likely to shoot it down and say, no, there's not really nothing you could do. Like changing your diet's not going to help. Doing functional medicine testing certainly is not going to help. So just
Mm-hmm.
be prepared for the negativity because I hear it a lot, especially with Graves patients. But even again, it doesn't really make a difference with Hashimoto's Graves. They're not going to do anything to address the cause, but there is hope. There's practitioners, not only myself, but others, many others out there that can help people with not only Graves' Hashimoto's, but again, different autoimmune conditions. And it's not, I mean, it's definitely more well known. There are even medical doctors now out there who are practicing functional medicine. And if someone walks in their doors with an autoimmune condition, they're not going to just give a drug. They're actually going to try to find and address the cause of the problem. So yeah, the number one thing I would say is that there's hope, but you need to take action. You need to, and if you just start with the foundations, that's fine. I mean, if you just clean up your diet, block out time for stress management, um, get regular sleep, regular movements. Again, I mentioned you very well might need to do more than that, but that's a great starting point.
I think that's probably the biggest challenge for people that most people don't want to do the work. They just want a pill to fix it all. And I think that's probably listening to that because I say that as well, but you see, hear it and go, that's the problem. Most people are not self motivated to do any of that work that it takes to help really get long lasting results. And they just rather take a prescription drug or a supplement that's going to do it all. And there isn't just one magic pill, is what we're saying. And what I always say too is chronic stress impacts everything. And so if we don't resolve what stressors you have externally and hidden sources of internal stress, it's really hard to make the right progress. You might feel a little bit better with that supplement or medication, but we're really not getting to be your best self and thrive again. And I think a lot of people get used to feeling crappy, that that's their new normal. They don't know what's any different from that.
Yeah, I agree. I mean, you definitely need to want to get better and need to be willing to take responsibility for your health. I mean, again, yeah, would I have loved to when I was dealing with Graves, just to have a magic pill where it would restore my health? I mean, there is that magic pill for Graves that destroys your thyroid gland. It's called radioactive iodine, but it's not magic because again, once you destroy your thyroid, you need to be on thyroid hormone replacement. And again, it's not doing anything for the cause of the problem. And so, yeah, you're absolutely right. I mean, people need to be motivated. It's not easy. It's even if you are motivated, it's easy to get discouraged. But what I would encourage you is to try to think about the opposite, just how it's again, not only you're not only making these changes to help your Graves or Hashimoto's condition, but your overall health as well, and to prevent other health conditions, not just autoimmune conditions, but just cardiovascular issues, cancer. I mean, again, this is really going to just help to optimize your overall health. And then, I mean, if you have children or grandchildren, you could pass the knowledge on to them and prevent, because again, there is that genetic component. So if you have children and you're dealing with Graves, Hashimoto's, there's a chance that they might develop it if they're not taking care of their health. So by you taking care of your health, and hopefully you're also taking care of the entire family's health again. So don't just think about it like, yeah, I mean, and again, I was there too. It wasn't easy, but I'm glad for the reasons I mentioned. It not only just for reversing Graves, but just optimizing my overall health in the future. I have two daughters and just passing that knowledge on to them and my wife.
Well said. So where can people find your resources, your programs, your podcast?
Yeah, thank you. So my podcast called Save My Thyroid, which they could check out by visiting savemythyroid.com and clicking on podcasts, or just visiting your favorite podcast platform and typing in Save My Thyroid. I have three books on thyroid health, natural treatment solutions for hyperthyroidism and Graves' disease, which is now in its third edition. The Hyperthyroid Healing Diet, which is my most recent book, and then Hashimoto's Triggers. And then I have a newsletter, Healthy Gut, Healthy Thyroid, which you could check out by visiting savemythyroid.com/newsletter.
Perfect. Well, thank you for everything you're doing and following your purpose. I always believe that everything happens for a reason, and good and bad situations that we can learn from that. And then you're paying it forward, helping other people live their best life and helping them get the right results in a personalized program. So good on you.
Thank you. Thank you so much. And again, this was a great conversation, Debbie, and appreciate you having me on.
Thank you.